Good afternoon, colleagues. May I confirm if audible enough? Can anybody hear me? Good day, colleagues. Okay, okay. Thank you. I guess I'm audible enough now. Thank you so much for confirming. Um, Colleagues, good afternoon once again. Thank you all for joining today's CME session. We really appreciate the commitment to strengthen the quality systems across our laboratory and to build a culture of learning in compliance with our eh, expectations to ensure competency as we practice in the different labs and also to meet the requirements of the regulatory body. So today's session focuses on a critical component of our ISO 15189 2022 framework, focusing on internal audits, management reviews, and staff engagement, which are elements that forms a backbone of a resilient and also a continual improvement quality management system, and they guide how we ensure competency, consistency, as well as patient safety in our daily work. We do try our best to record these CME sessions for everyone to catch up on the topics, which are then later uploaded on the YouTube open source channel under the Eswatini Medical and Dental Council page. And then when you go there, you'll find the laboratory CADA playlist and you'll find the recording of each session because I'm aware that a big chunk of the practitioners can't join on this hour, but we do have the session. So the quiz is then posted at the end of the Q&A session after each presenter, which acts as our register, like I always mention, colleagues. And please do make sure you complete it. It's just your demographics and maybe one or two questions about the topic that you're having that day. Then the certificates of participation will be generated and shared back to the email, and which acts as a evidence of your participation. And for those who have the CPD logbook, please do document the training in your CPD logbook. And although there's a backlog in the certificate generation, but we'll try our best to have them all out before maybe we go for Christmas. So it is now my pleasure, colleagues, to welcome our presenter, Ms. Shirley Shabangu, representing the Cebra Lancet Eswatini. She brings valuable experience in quality management systems and laboratory strengthening, and we're honored to have her lead today's discussion. To everyone in the room and online, thank you once again for your participation. Please feel free to share your questions in the chat section. Um, and we'll address them after the the speaker has finished today's session. Miss Shabangu, over to you. Thank you. Over to you, Shirley. Shirley, are you there?
Okay. Good morning, everyone. Good afternoon, everyone. I'm not sure if I'm audible enough.
Yes, yes.
Hello.
Thank you.
Okay. Sorry about that. Unfortunately, I didn't have access to unmute myself. Thank you, Mr. Tlamin, for doing so. Uh, thank you so much, everyone. Welcome to this training session where we're going to talk about internal audit, which helps us to know where we stand, and management review, where we will be able to get it direction, and then staff engagement, which is the power engine that helps us with our laboratory progress. Okay, introduction. The objective of the training is to understand what internal audits are and why they are important. It will help us learn the purpose and steps of effective management review. It will also identify simple ways to improve staff engagement and ownership. We will also see how all the three areas work together to support continuous improvement. By the end of this session, the attendees or the participant will be able to support internal audits more confidently, take part in management review using clear and useful information. You'll be able to understand your role in improving engagement and communication in the lab. It will also give you best practices to boost the compliance and performance in our organizations, and also better connect daily work with overall organizational roles in our different labs. Okay, when it comes to internal audit overview, internal audit view as a definition, it's a systematic health check that ensures our processes are working as intended. They are aligned with our quality systems and fully compliant with the relevant ISO requirement. For the lab, we are complying to ISO 15189, which is the 2022 standard. Um, the internal audit should be planned in intervals whereby it shall be in frequencies, and the lab should document that and be able to determine when should they have the next audit. This whole exercise, it just checks a compliance whereby the lab is being evaluated if it's meeting its own laboratory procedures that are documented in the lab, in our SOPs or manuals, and also all those procedures meet the ISO 15189 standard. It will also help us to see if ever our QMS, which is our quality management system, is effectively implemented and maintained. We do have processes. There is sort of like a roadmap on how to do an internal audit, where the first step is planning. Planning is very, very crucial because you need to define the scope. The scope means the test or the department or the disciplines that are going to be audited. They should be indicated and highlighted. When it comes to criteria, we need to consider a lot of factors, which include risks identified, non-conformities that the lab has. We need also to look at previous internal audits, um, as well as my external results. Um, we also have to we also prioritize my patient's risk, which maybe again, we have to look into EMA complaints. And then, yes, there will be an audit team. When they are performing or conducting an audit, there'll be people that are coming to assess the lab. Those people should be trained and deemed competent to assess Laoma disciplines. And again, an emphasis is that the people that are going to audit that department, we should make sure that they are well versed on that department, so that we don't have impartiality or areas or mark gaps not identified by the auditors. And again, with the auditors, we need to have independent team, so that we are sure that whatever that they have identified, they will be able to share with the team without any fail. That's the first step. And then again, we have the second step, where is execution. I think most of the labs have been exposed to internal audits. The staff in the lab, they have seen this, which is staff interviews. Staff will be asked questions, there will be interviews, there'll be checklists that will be completed. And when it comes to my observations, We'll have staff being witnessed performing a test, and all that will be documented. And again, they'll be requesting our records, our files, so that they can start reviewing our records. So all that has to be kept and easily retrievable so that we are able to have a very smooth and productive internal audit. The third step will be reporting. Definitely the findings, whatsoever that will be picked, or there will be any deviation or any fail to meet EMA standards will be documented and will be raised, and will be communicated to the team as non-conformities. And EMA strengths, yes, is well implemented, they will note that. EMA weaknesses they do as well, whereby they will tell us or suggest a room for improvement in our systems. Step 4, we will have EMA corrective action. We will do corrective action whereby root cause analysis will be performed, and the team is expected to get the actual root cause. Most of the labs, we just put a root cause on our audit reports. Sometimes we haven't yet investigated and actually got the actual root cause. And then the action plan, once you action something that is not there, definitely on the next audit, when they come back, these auditors come and audit your lab, they will pick the very same problem or finding. And then that means that we didn't investigate or we didn't action the actual root cause for EMA fails in the lab. Step 5, it will be just to monitor effectiveness of the corrective actions implemented, evidence given, and to see if ever whatever that we have corrected, was it well or sufficiently mitigated. And then again, from the audit, once all that has been done by the team and the auditors, the auditee should make sure that they have these records for evidence of internal audit. It will be the audit schedule plan or the audit plan. Some people, they call it the audit plan or program, which shows when the audit were planned. So it's not something that they will take you by surprise to come to the lab to audit, but they will communicate the dates and which areas or tests that will be covered during that audit. There will be audit checklist or tools used, whereby it's forms, whereby or checklist, whatever that each lab uses, but it must make sure that it's completed during the audit. The audit notes and observation, I think I also highlighted that one is the strength, what will write whatever they've seen as written evidence of what was reviewed, inspected, and discussed. Then they will have my audit interview records, notes from staff interviews or discussion conducted during the audit. So most of the time we'll see auditors writing as the auditors, that's something that is acceptable. Then the non-conformity report, definitely they will document EMA findings, and our findings are classified as minor, major. Most of this thing is we look as to which ones affect my patients, and then if it's minor, you find that it doesn't have so much impact on my patient results. But major, it's something that needs to be addressed because it can greatly, or it is greatly affecting my patient results. We do have a corrective action and request whereby we record Lama actions assigned and address Laoma findings. We need to keep a trail of a submission of a audits and make sure that we submit in time. Then there'll be evidence collected. It is very, very important that with every audit or every finding that has been raised, we need to make sure that we have corrected it. And then if it's possible, you can put photos, pictures. They will need to see copies of the document if ever you have amended, records reviewed, or sample data. So this is very important to show that you have worked on Lama actions. Then the audit report, it will be summary of the audit findings, conclusions, and my recommendations. They will put all that to say that the lab needs maybe to sort its record documentation. I'm making an example, or everything was fine QMS is well implemented. So those are the recommendation, maybe the conclusion that we'll have for that lab. Then on follow-up records, definitely we'll have the auditors coming to the lab. They will check on the evidence and if everything was done and verify if the audit effectiveness of corrective action was done and all the incidents that were occurring at that time, they have reduced. Let me just put it like that. Then obviously we do have meetings, which is the opening and the closing, but the closing is very important because we are able to see that all the findings or the action were communicated to the relevant team. So it's very important that once we conduct this audits in the lab, we share with the relevant team or departments or personnel on what was observed in the lab. We do have benefits of my internal audit. It's something that is very key when it comes to the lab. First of all, it ensures that our testing methods, equipments, and records always give reliable results. Number two, it improves workflow and efficiency by spotting delays, unnecessary steps, and gaps in our processes. It also encourages proper staff training, documentation practices, and adherence to procedures. More than anything, it supports us getting prepared for external audits. Hence, we don't expect the labs to be preparing for an internal audit, but we prepare for my external audit, looking at my internal audits. Okay, I think I'm done with my internal audit. I'm not sure if ever there's anything that the team will want, but without wasting any time, I'll proceed to management review. Okay, for management review definition, it's a structured assessment conducted by top management or senior management to determine whether the management system remains suitable, adequate, effective, and efficient in supporting the organization's established policies and objectives. So there will be policies in the lab. There will be also objectives and quality indicators. So basically management will sit on the defined time and go through all our records to make sure all our reports and records to ensure that they analyze and allocate. What do they analyze? They review our performance metrics for informed decision making. With allocations, they will be assessing MR resources, which is our analyzers, our staff. There's a lot that they will assess, which forms as the asset in the lab to optimize the operational efficiency. Okay, management review requirements. We do have my internal audit reports. It will also cover your quality indicators, customer patient feedback, non-conformities, and corrective actions. Risk and opportunity assessments will be part of the reports or the agenda. Supplier and vendor performance, how are the supplier performing, and changes affecting the QMS. Then very, very crucial is also see and review MR resource needs in the labs, different labs. Once they've finalized the discussion, they will move on to have MR outputs. The outputs must include improvements needed, changes to processes, resource allocation decision. They will have to make MR decisions, quality objectives updates. Maybe they will somehow change or amend MR objectives. If ever the lab was well performing, some quality objectives will be cancelled and new ones will be put in place so that maybe we can try to get more results. Action and assigned and monitored. Actions will be assigned to different staff and monitored. Even management review is a process. It's not something that they just do. They plan the review where they schedule a meeting They should be communicated. Key participants, which is management, senior management, top management, anyone involved in the management, they will set a jet and they will have an agenda, which is some of the inputs that I had highlighted on top. And then they will collect inputs, which are audit results, non-conformities, all those ones that I've touched on. Definitely they're analyzing and discussing. They will evaluate the plans as well, because you can't just assign someone on a task yet they don't know what was discussed. Because most of the time staff, unfortunately, it doesn't join a management meeting, but they should, when it comes to documentation and communication, the minutes that were recorded on that one should be distributed to staff so that they'll be able to see the action plans. Implement and follow up, execute my actions, monitor progress, and evaluate effectiveness. I think we can see that every time it's more like effectiveness, we need to evaluate effectiveness in our labs. Then we have a management review benefits, where is to keep work aligned with goals and quality standards. It will help improve processes and make better decisions, ensure compliance with rules and regulation, promotes the review of resources and reduce MR risks. It will also enhance staff engagement and accountability, whereby now we see again staff engagement is important. We'll move on to the third item, which is staff engagement overview. This is a very, very, very important key point in the lab when we're talking about staff. Staff is an asset in our labs, whereby we need to support each other. Staff engagement refers to the degree of commitment, motivation, and active involvement employees demonstrate towards their roles in the organization. It's very easy to see staff less engaged, whereby engaged staff show initiative, assume responsibility, contribute effectively to the achievement of organizational objectives. There are ways, it's not only management, there are ways staff can improve staff engagement in the lab, as well as management that can assist management to have staff engagement in the lab. The first one is open communication, where we need an effective two-way communication between management and staff. The team, which is the technical team, the phlebotomy team, whatever team that we have in the lab, we must be able to communicate effectively. And it should be transparent as well. And then that can be done, management can do that as well by sharing my updates on performance, my goals, and my changes, not staff just seeing my changes without being communicated to them. And then when it comes to recognition and appreciation, this one is to make sure that we acknowledge my individual and team achievement regularly. It's a very good exercise whereby we celebrate my milestones, quality improvement, and exceptional performance. We shouldn't be always talking about non-conformities, incident reports, all that, but we must celebrate even my small wins. When it comes to training and professional development, management needs to offer continuous learning opportunities and skill development programs. Like today, we are having MR workshops or attending MR conference or virtual webinars. This is something that we can see that our management is working on to get MR external exposure when it comes to trainings. Support MR certification, staff being given MR study leaves, MR workshop. Maybe you have MR training like external, except for the local trainings. Okay, we have MR empowerment and involvement, whereby we need to involve staff in decision-making processes, problem solving. By doing so, we increase the ownership on task. To all managers and supervisors, we need to ensure that we delegate my responsibilities. It does give a team a confidence because they are doing things right. Okay, supportive work environment. This is also important. I-toxicity foster teamwork, yes, collaboration, and positive lab culture. This one I will also say, even for the staff, they need to do things right the first time. That helps as well. Ensure my resources and my equipment and workspace are adequate and safe. So our workspaces should be safe for each and every one of us in this meeting. So it's something that staff should know. Because once you do that, you make the safe space for each other, then staff engagement is increase. Then the other thing that this is just a continuation on ways to improve staff engagement in the lab. Feedback, performance reviews. We need to provide constructive feedback and encourage staff to share ideas. Use performance reviews to set clear goals and track progress. When it comes to promote work-life balance, Nasehle say it reduce burnout by managing workloads and stresses, whereby we need to also do an exercise to do like to see if staff is adequate in the different departments, looking at volumes and matters that are being processed, so that is to avoid a staff set to see what sigcine workload learning, and also support flexible schedules or wellness initiative where possible. My career growth and opportunities, that's something that we need to do so that staff can be confident in our processes and in the lab to help us achieve QMS is to create a clear path for advancement within the laboratory or organization by encouraging mentorship and coaching programs. We do have benefits as staff engagement in the lab. Once the staff is happy, definitely there will be an improved productivity and efficiency, whereby engaged staff are motivated, proactive, and perform tasks more effectively. Now, when we have my internal audit, you won't find my gaps lamaning. Then there will be higher quality and accuracy. Definitely, staff will pay critical attention to details and ensure reliable test results. We won't have my NCs when it comes to good staff maybe didn't check my temperatures on that day and stuff, because staff now and enhance teamwork and collaboration. It helps the staff to communicate and cooperate better compliance and safety, motivate staff to follow my procedures, regulations, safety protocols, and increase job satisfaction and retention. This will engage good staff it will make staff to boost the confidence, and again, we'll have less of a resignation from staff, and it will also attract the talent. We will see people outshining themselves or bashina. Supports continuous improvement. Once we have engaged staff will be able to give out my ideas that will help us to have a better working space and ideas to improve our processes, and also they'll proactively create my new solutions without being micromanaged. Okay, the conclusion on all this was a reference to key ISO 1518922 clause related to staff engagement, competence, and management system. Under management system, we have internal audits, which is under evaluation clause 8.8, and for internal audits, they are on clause 8.83. For management reviews, that one is on clause 8.9 on the standard. And for staff competence and engagement, which we have spoken about, the trainings, what's needed, competency requirements, ongoing training, which is that staff development, authorization, and personnel records. That one we got it from the standard clause 6.2.2. Now we are with 6.2.5. Thank you. A short quiz will follow afterwards. I wasn't. Hi, Mr. Dlamini.
Thank you so much, Shirley, for that wonderful session. We really gained a lot looking at the management reviews, internal audit aspect, and also the staff engagement. It was really, really interesting. Thank you so much on that regard. And this is pivotal in the implementation of our ISO the standard. And I hope that in this series of QMS-based sessions we're having in this quarter, we will have so much and deeper understanding of the whole expectations with LQMS implementation. So, colleagues, I think at this moment, can I open up for a couple of questions? You can raise your hand um, or post on the chat box so that we can deliberate on them and our speaker can also respond. Maybe to start with, we have one in the chat box. I think it's from Dumile, I guess Barnes. It says that can we engage Lancet trained officers to conduct internal audits for our labs? Or who conducts internal audits for you as Lancet? Shirley, would you like to respond?
Okay, for us, we it's an internal exercise whereby we have people like our colleagues at Lancet who are trained but in different countries and also department that will come and audit us. But I don't think it will be a problem. It will have we have to have just maybe a request which we can submit to our management. If ever maybe they will love someone from Lancet to come audit their labs.
Awesome. Thank you so much on that. Thank you so much for that. So the public sector, uh, okay. There's a follow-up from my plans as well. Would you charge us?
Okay, that one we definitely, because I think with the request we have to seek your approval. So yeah, I don't think we can maybe finalize and maybe say something now, unless maybe there is a request, then we can discuss and then give you feedback.
Okay. Thank you so much. Thank you so much. Colleagues, can I open up for another question from your side? Feel free to raise your hand or maybe post on the chat so that we can deliberate. There are no questions. Okay. There's also a part comment from the on the chat section. My husband is saying that she liked the staff engagement part, of which was very interesting. So much. Thank you so much, Shirley. And colleagues, in the absence of questions, may I post here the small quiz on the chat? It's like our register, just like I've mentioned, since we're coming to an end of our today's session, please take your time and just go through. Um, there are about five multiple choice questions, but mostly we just want to gather who was here today and so that we can document it. So I've posted on the chat box and also I can share my screen so you can scan the QR code as well. Okay. Please scan the QR code, colleagues, on the screen, and also on the chat box. There's a link to the quiz. As we are coming to an end of our session today, Ms. Shabangu, thank you so much for sharing with us. We've gained a lot. And colleagues, once again, thank you so much for joining. I hope we can do this again and build a culture of learning. And still, I invite everybody who has an interesting topic to share among the lab space. So to contact me, write me an email or text me so we can start that discussion. Thank you.
Thank you, bye.
Thank you. Sure. Colleagues have posted the quiz link on the chat. Please follow that one. It will take you to the small quiz, which is like our register for each searching. Please complete. Or maybe if you prefer to scan the QR code on the screen, you can do so, and then it will gather it and document our session. Thank you.